Today, we will be discussing dental procedures that are safe during pregnancy. Many expecting mothers wonder about the safety of dental treatments during pregnancy. While some procedures may be postponed, others are perfectly safe. Let's explore them. Routine cleaning. Regular dental cleaning are not only safe but also highly recommended during pregnancy to prevent gum disease and maintain optimum health. Dental fillings. If you have cavities that need fillings, it's generally safe to undergo this procedure during fillings. X-rays. Dental X-rays are relatively safe during pregnancy with proper shielding. However, they are usually avoided unless absolutely necessary, especially during the first trimester. Emergency procedures. If you are experiencing a dental emergency such as severe pain or infection, don't hesitate to seek treatment. Prompt care is important for both your oral health and the health of your babies. Root canals. Root canal treatment can be performed safely during pregnancy, especially if delaying the treatment would risk your overall health. It's essential to communicate with your dentist about your pregnancy and any concerns you may have. They can tailor treatment plans to ensure your safety and the health of your baby. Remember, maintaining good oral hygiene and seeking timely dental care is crucial during pregnancy.